I think at some stage, if the individuals that we need don't hear Dr. Chan's message and don't respond, then at some point we're going to move to a stage where we're going to have to accept that the virus has a life which will continue in the community. But we're trying damned hard at the moment to make sure that we can use every effort to suppress that virus.
Now, if we don't have the vaccine, we only have lockdowns. And that's the very point I was trying to make, is that we really need to look at, if we're going to open back up, we need to start having the conversation about what that risk ratio will mean. And we need to have the vaccine in place in order to lift the borders, whether they're internal or external, and in order to get back to what we want as a real, way of living. Now, if you look at the UK, they've had two vaccines, a rate of double vaccination at around 67% of those over the age of 18. So 2/3 of the population have had two doses of the vaccine in the adult age population, and they've opened right back up. Now, we're seeing thousands and thousands of cases. There are concerns about hospitalisations increasing. Luckily, the death rate has remained remarkably low, despite the fact that there's this massive outbreak that's going on. So we're seeing a disconnect between cases and deaths. Yep. That's what we want, but that's the future. We need to start having that conversation here in Australia.
Jenny McAllister, after every Australian who wants one is offered the full vaccination, should we in this country be prepared that there may be deaths from COVID, and should we open up?
Well, the Prime Minister has asked the Doherty Institute to do some modelling about what kind of scenarios we could expect after we reach certain thresholds of vaccination. It's pretty hard to have a mature public conversation until that modelling is complete, and we would hope that when it is complete, it's released to the public so we can all have a look at it. This is going to be an important public conversation. Different people will have different views about it, but it needs to be informed by evidence. My concern is that it's a little bit late, isn't it? We've been working through this virus and managing the pandemic for 18 months. I think some of these conversations could have been happening a little earlier.
Okay, what's your instinct on it though? Because should we be prepared once we are as vaccinated as we possibly can be to bring the virus back in, essentially, not suppress it and deal with what might be some devastating consequences?
Well, I think we need to know what the consequences are likely to be. I heard your previous panellists talking about the fact that we're a long way off that point. We have a very small number of the Australian population fully vaccinated. By the time we reach 60% or 70% or 80%, we'll have been able to see what's happened overseas, and there will be some information available to us to help us have that conversation. I really think that it's very difficult to have a speculative conversation about it when we don't yet have any data or information.
No, I think what is really important for us to note is we're obviously working very hard to get out of this lockdown as soon as we can, but there's no doubt that everybody across Australia will need to live with some level of restriction until we get our vaccination rates higher. Some states have responded by shutting down their borders, other states have responded in different ways, but it's pretty clear that when we get out of this lockdown, and of course I'm not willing to give an end date just today until we get the data in the next few days and beyond, but what I will say is this: until we get our vaccination rates at a level which is going to protect the community, we will have to live with some level of restriction. And I think that's accepted. And we're looking forward to those extra doses in the end, that are coming by the end of September. And by the end of October, there'll be a much higher rate of vaccination. But having said that, please know that we're working as hard and as quickly as possible to get out of this lockdown. No, that was just an aspirational target we had set, which equates to about 80% of the adult population or 62% of the population of New South Wales. As the leader of the New South Wales government, I was willing to put a target on the number of jabs we wanted before we could have conversations about opening up our state and living more freely. And I also think it's important not only to have the 10 million jabs, but also to make sure that everybody who wants the vaccine has access to it. And after that, we can make those decisions.
Just on the JobKeeper question.
It's like everything else. It's a proportionate risk issue that has been managed right through this, and we will continue to manage that until, as was said earlier, until we've got the vaccine. The answer is, I think people sort of forget that this is the second time we've had a pandemic in 100 years. The first pandemic was quite indicative of human response. So what happens is you get through a certain phase. Human behaviour is you all go back to doing exactly what you did before. The result is in the pandemic in 1919, they had a series of waves. That's been repeated in other countries around the world where they've had managed to reduce the rate. There is only one solution here. What we're doing at the moment is trying to manage it, but we won't get the solution until we get a high proportion of our population vaccinated, and we remain challenged by vaccine supply. Sorry.
More measures, more mask wearing, more rapid antigen testing, those kind of measures, I think we're going to have to start living with that till we're all vaccinated or close to.
Yeah, indeed, and then maybe beyond. All right, Phil.
Yes, David. Look, I think in this country we have to start adjusting our mindset, even though we're on track, hopefully, to hit the British vaccination rates by early next year. I know in Britain this week they've had 300,000 cases, 284 deaths, 54,000 a day. Even when we're vaccinated, if we want to be like Britain and go to the golf and the Formula One and Wimbledon and so forth, we're going to have to adjust our thinking to have cases in the community next year. Otherwise, we're going to be where we are for a long time.
And they lift all their restrictions tomorrow, which will be
a long tail of restrictions. He says that this is going to keep happening. Lockdowns are going to be keeping an issue if vaccination rates aren't higher, and until that happens. But of course, the big question is this a sustainable policy and strategy to keep locking down every time there's an outbreak, given the impact on mental health and, of course, on the business community?
The worst situation we've seen ourselves in since, of course, last year. Now, the Prime Minister canvassed what the future looks like. What did he say, David?
I thought this was interesting because I've found, and you've probably found this as well, whenever you interview politicians on either side, they're very careful, very cautious, very reluctant to weigh into what happens when we do have vaccines eventually offered to everyone and hit whatever target it is that the W.T.F Institute's working on over the coming weeks as to the population-wide vaccination required to no longer have lockdowns, no longer have state border closures and so on. Are we willing to accept there will be COVID in the community and some deaths? Hopefully not many, given as many people as possible are vaccinated, but we've seen a real reluctance, as I say, from politicians and particularly political leaders, state and federal, to broach this issue. But the Prime Minister did today, and I do think this is a conversation that needs to be had. What did he say? Well, he said the issue will be getting this virus back to a level where we can treat it like other viruses in the community. He said that that's the benchmark. None of us want to see anyone lose their life because of ill health, but sadly, that's the truth of mortality. So I suppose he is starting to prepare the nation, begin this debate. Yes, we will have to see some COVID deaths, sadly. Look, hopefully not many, and hopefully as many are as vaccinated as possible, and we still don't know what that number will be that the W.T.F Institute and then the politicians will settle on in terms of that risk appetite. But yes, there eventually will have to be an acceptance of some COVID deaths in the community. And I think, look, it's not much of a bold statement, I suppose, in one sense, but it's more than we've heard, I think, from many in either side of politics about the willingness to accept, yes, there will ultimately have to be some mortality when it comes to COVID.
The people that we have lost in this most recent outbreak in New South Wales were over 70 and were unvaccinated, as I understand it. So even at 75%, that doesn't mean that you've completely operating a risk-free environment. But I do recall...
Prime Minister, even once we get to a stage where, like what we see around the rest of the world with much higher vaccination rates and freedom without lockdowns, there's going to be a lot more deaths, just being realistic, than we're facing now. Political leaders, yourself included, have been keen to talk about deaths being unacceptable. Do you think that that's going to change eventually when we accept that COVID is going to rip through a hopefully close to fully vaccinated population? There will be deaths.
There are considerations here. The first one is that we need to provide everyone who wants a vaccination in Australia with that opportunity, and we're on track for that by the end of the year, and that puts us, despite the challenges we had earlier in the program, particularly around the medical advice that was given around AstraZeneca, that puts us around about 2 months and behind where we hope to have been. We've been catching up ground on that, and that's welcome. So there is that element that if you wanted one, you could have had one. So you've had a conscious decision about whether you've sought to protect yourself from what is a very virulent virus. The second part of it is the epidemiology. And what that says, and looking at issues of hospitalisation rates and ICU rates and so on for people who are infected, the plan I outlined from National Cabinet has an important transition in step 2 and step 3. And that is we go from suppressing the virus, which is about case numbers, which is why we're having to do what we have to do right now, and we're always going to have to do at this stage of the pandemic, and moving to a situation where you're focusing on whether the virus is leading to people going to hospital, whether the virus is leading to people sadly losing their lives in a way that would be demonstrably greater than what occurs with other viruses. Of course, there are many viruses, there are many diseases that cause fatality in the community. The issue is getting this virus back to a level where you can treat it the same as other such viruses in the community. And that's really the benchmark. That's the mark you've got to get to. None of us wants to see anyone lose their life because of a virus or ill health. But sadly, that's the truth of mortality.
See, look, there are those in the Liberal Party in New South Wales who want to conduct a similar experiment. There was a breakout in Cabinet. We read about it in the newspapers. 3 Cabinet ministers said, let her rip. I mean, is the bottom line here that if you're the sort of Liberal who says, I believe in small government, you believe in a big pandemic?
I wouldn't say that. I think there's probably more frustration that the end is not in sight yet, and it comes down to where we want to be as a nation and what is that level of risk we're willing to take now. Following the health advice, Australia's taken a very high threshold in terms of public health and safety, which I think is the right decision to take.
But only because the Premier of New South Wales seemed to wrestle 3 Cabinet ministers to the ground and say, we are not doing it. I mean, there's a front page report in this city last week that said, we want to lift this lockdown for economic reasons in New South Wales. And there was a strong push, apparently, by the Treasurer of New South Wales to let her rip. Small government, big pandemic.
Look, there are those reports, but you need to take everything on the whole, which is most state premiers are adopting a very similar
But I'm talking
approach.
about the Liberal Party here.
Yeah, but look at South Australia with Stephen Marshall or Peter Gutwein and Tasmania, or the Prime Minister through National Cabinet, and Gladys Berejiklian. You can say, look at the Liberal Party and then say, well, Gladys Berejiklian isn't part of the Liberal Party. She's the Premier of New South Wales and the parliamentary leader of the Liberal Party.
Well, is this the death knell for the let her rip, small government, big pandemic in the Liberal Party?
I don't think that's even a proposition within the Liberal Party. More
Certainly it's a proposition within the Liberal Party.
It may be the view of a couple of cabinet ministers around the table, but let's look at what is actually happening, which is not the Liberal Party governing here, it's the democratically elected government of New South Wales.
This will take off if we allow it to. We do have to extinguish each and every chain of transmission because even in places across the Northern Hemisphere with high vaccination coverage, yes, they're decreasing the number of deaths that they're seeing, the pressures on their hospital system, but it's still ramping up. Even as the UK experiences Freedom Day, as they're calling it, 50,000 cases per day. These are profoundly challenging times with this virus, in particular the Delta variant. We have to win, we have to extinguish it.